Hi, I am Brian Pham,
And I'm Ryan Vassalotti.
and we are going to talk about urgent care centers.
First, we must define what an urgent care center is. It is a healthcare facility that is aimed towards helping people with serious but non-life-threatening illnesses or injuries. Some examples of injuries found at urgent care centers are cuts with minor blood loss that require stitches, minor fractures, and a variety of other injuries caused by accidents and falls. Some illnesses commonly treated at urgent care centers include the flu, asthma, and urinary tract infections.
Some of the services provided at urgent care centers include IV fluids, diagnostic tests such as X-rays and MRIs, and treatment of sprains, fractures, falls, nausea, vomiting, and diarrhea. Drug tests, vaccinations, and physicals are also provided. Occupational medicine makes up a large portion of services done at urgent care clinics. This form of medicine involves the treatment of work-related illnesses and injuries.
The employees at urgent care centers include physicians, physician assistants, nurse practitioners, nurses, radiologic technologists, medical assistants, and a front desk receptionist. The physicians and nurse practitioners diagnose and treat the patients. The physician assistants, the medical assistants, and the nurses take notes, vital signs, and record the medical history of the patients. The radiologic technologists perform the diagnostic tests like X-rays and MRIs, and the front desk receptionist helps organize scheduling and payment.
Some benefits of urgent care centers are that they are open either the entire day or most of the day, and they often operate on the weekends. If your primary physician's office is closed, then urgent care centers are the place to be. Additionally, urgent care centers cost significantly less than hospital visits, and also have shorter wait queues. As long as your problem does not require immediate attention, urgent care centers are optimal. If you have a serious injury, however, then going to an urgent care center won't likely help. Most centers do not have the equipment or the personnel to deal with life-threatening injuries and illnesses.
Urgent care centers are primarily owned by corporations, hospitals, non-physicians, joint ownerships between hospitals, and investors. The ownership of urgent care centers has shifted considerably in the past decade. Urgent care centers were primarily owned by a physician or a group of physician investors, while now it is primarily corporations that own urgent care centers. In the year 2017, there were a total of 7,639 urgent care centers in the U.S. The general trends of urgent care centers are that they are rapidly expanding and hospital ownership is decreasing markedly. This graph to the right depicts some of the ownership trends that have been discussed. Here you can see how corporate ownership has increased, while physician ownership decreased.
Here is a local example of an urgent care center, which is the Watson Clinic Urgent Care at Maine. Another example of an urgent care center is the CareSpot Urgent Care located in Jacksonville, Florida. Here are the websites we took information from when creating this presentation. Thank you.